Greetings, and welcome to another edition of Community Chest. I'm Felix Milan, your host, and I'm very happy to have my next guest here, Rita Hoover, from the South Coast Diabetes Association. She's the president. She's also a registered nurse and a certified diabetes instructor. Is that correct?
Diabetes instructor and also a diabetes educator.
Okay, well, welcome to the show.
Thank you.
Thank you. And tell me what you do with the Diabetes Association, your position.
I'm a president of the South Coast Diabetes Association. Our main goal is to get information out to the public about diabetes and also help the community. We found that the dollars raised were going elsewhere, and we found that locally the people here needed the help. And so once a year we do a diabetes fun walk at Bannon City Park, and we walk along the beach or we walk along the beach loop, and people have pledges to walk. And this last year in May, we do it usually every May, we raised about $8,000, and 100% of that stays locally for people to receive medications if they can't afford to buy them, for education, sending kids to diabetes camp, and footwear, whatever's needed for people in the public.
That's great. And I know that this has been going on, this diabetes walk, for several years.
Yes.
But this is new that the money is now staying here in this community.
Yes.
Can you expand on that just a little bit, on why that change happened and why that's so important for this, the Bay Area?
Yeah. We're locally, we found that people just didn't have the funds, with our economic status here, and we wanted to help out people locally first, so we could get better diabetes education to them, because we found that our percentage of diabetes in this local area, in the rural area, is a little bit higher than the national level and the state level. We're at about 7%, whereas the state is about 6%.
Why is that? Why is there a higher incidence of diabetes here?
I think one of the reasons is that education. We need to get out more education to the community. I think most people think I have diabetes and that's like maybe a death sentence, or I'm going to have all these horrible complications, and it just doesn't have to be that way. It's very controllable. It's not always the easiest thing, but it is very controllable, and you don't have to go down that pathway. I went to Washington, D.C. Last year, and Dr. Polensky was speaking, and he had us raise our hands if we have ever heard that diabetes causes complications. Of course, we all raised our hand, and he says no. And it's like we all looked at him, and he said uncontrolled diabetes causes those complications, and it just really doesn't have to go down that pathway.
We don't know who Dr. Polensky is. Is he a local physician?
No, he's a psychologist that's written a book, has a couple of books out there, and
he's considered an expert in diabetes.
Yes.
Okay, so let's digress here a little bit, okay? And let's explain diabetes. What is diabetes? First of all, I know there's two types. If you can explain that, and then maybe we can start looking at what kind of signs people can notice if they maybe have the disease. Yes.
There used to be all kinds of names for diabetes: youth onset, adult onset, insulin dependent, and we try to just make it simple now. We have type 1 diabetes. Type 1 is where some kind of maybe a virus or autoimmune system has attacked the pancreas and killed off all the cells that produce insulin. So those people now have to take insulin for the rest of their life. Very controllable. And that's most of the people that develop type 1 diabetes are young. But occasionally we have an adult that develops type 1 diabetes. Then we have type 2 diabetes, and they're still producing insulin, but maybe just not as much, or it's not working as well as it could. And most of the people that develop type 2 diabetes are adults. But occasionally, more lately, we're having more children developing type 2 diabetes with fast foods, video games, computers. Our kids aren't getting out there and getting the exercise that they need, and maybe eating more high-calorie foods.
So the key for adults having this type 2 diabetes or getting it is a sedentary type lifestyle and diet. What else could contribute?
Diet, that's a 4-letter word. It's just all about a healthy lifestyle. No one can stay on a diet, I feel. If you just learn about a healthy lifestyle, it's nothing you can blow and say, oh, okay, well, I blew that, and I have to start all over. It's just like, okay, I learned from that. And
so then, if you can control your diet and have an active lifestyle, the chances of getting diabetes too is lessened. Could it be also genetic that even if you do these things, you might still contract the disease?
Yes, there's some risk factors for type 2 diabetes. Type 1 and type 2 diabetes is a genetic influence, but with type 2 diabetes, it's more of the healthy lifestyle that makes a big impact. Some other some risk factors are age, weight, if you smoke or you don't smoke, cholesterol levels. If you have a large baby, that tends to you tend to have increased risk down the road. And that's another type of diabetes, is gestational diabetes, where you have diabetes during pregnancy.
I see. Is that common?
Yes, and the placenta is putting out hormones that make the body more insulin resistant, where the insulin just doesn't work quite as well as it should, and so their blood sugars are a little bit higher.
So, excuse me and forgive me if I'm not saying this correctly, would a mother-to-be, would she be pre-diabetic or borderline diabetic to be afflicted with gestation diabetes?
No, they would develop it during their pregnancy, and usually 97% of the women after they deliver do not have diabetes afterwards.
I see.
But if I always encourage when a patient has gestational diabetes that comes in to see me, that they live like they have diabetes for the rest of their life, because they've shown studies where if they live like they have diabetes, they're less likely to develop it later on.
I see.
If they don't, and they continue to do maybe more sedentary lifestyles, maybe heavier, within 10 years they're more likely to develop type 2 diabetes.
I see. So that's almost like a cursor towards having something like that, kind of a warning flag there. Now you said where you work. If you would please tell our viewers where you work and what you do there.
I work at Berea Hospital. I've worked there for about 22, 23 years. I'm also a certified diabetes educator, and I've been teaching diabetes classes for about 5 years now. We have a whole variety of classes that we have available to the public, from diabetes talk groups to support group, to kidney care classes, stress management classes, because we find that along with diabetes comes other factors. If you manage your stress levels, it plays such a big part in managing your blood sugars, blood glucose.
That's the same?
Yes.
Okay.
Yes. And they